you can imagine, in some populations, mental health is the top reason for maternal death. And that's something that when I read those a couple of years ago, I was shocked.
Wow.
And it's gotten worse as well. So that's a big issue. And that, I think, ties into some of the social determinants of health.
Yeah, speaking of which, let's talk about the social determinants of health, right? Like, what are some of the key factors that, come into play as you think about this? Because to some degree, it becomes a complex algorithm, right?
Yes.
Right?
Oh, yes.
So you take the health, you take the age, you take the race, and you take the zip code, and then you take so many other things.
Right.
And then you have a complex algorithm that could determine, and mental health, right?
All of that.
And if age has an impact on how well you do, then, maybe even that worry of, oh my God, I am 40 years old and I'm having a baby. That itself can cause stress.
Absolutely.
Yeah.
Absolutely. So
talk
everything
about
you
all-
mentioned,
yeah.
and it's very complex.
Very
right?
complex. So let's focus on the social determinants of health. So speak a little bit more about that.
Yeah, so you said zip code a few minutes ago, and I think that is just absolutely critical. So there's no doubt that where you live in this country has a lot to do with how you are going to do in pregnancy.
Yes.
And your risk, actually, of dying, right, related to a pregnancy.
Yes.
One of the key issues that I think is so interesting and sad at the same time is what we call these maternity deserts, right? So a maternity desert basically is defined as an area, a zip code, where there's no obstetric care, no obstetric practitioners, and no obstetrics facilities, right? So no hospitals, no labor, wards, and even no maternity, other options, basically, right?
Yes. So mental health,
Yes.
The state of mental health, how healthy you are as it relates to your mental health has a impact on, the rates of maternal mortality.
Directly.
Directly.
Yes.
Wow.
So
what do you think the reason is?
Oh, I mean, there are many, right? I mean, think about life these days and COVID. I mean, everybody's stressed,
We're all
right? So
stressed
there's a
out, yeah.
baseline, I think, of stress. Add to that a pregnancy, right? Add to that childbirth. So now you're adding either your first baby, which is the most traumatic of all, or you're adding to your family. So the stress levels naturally go up. We don't have good supports for women in that postpartum period.
Yes.
If you look at sort of what are the kind of the two big killers, mental health, postpartum depression, which is being talked about, thankfully, a lot more.
Yeah.
It's getting to be unstigmatized, and we can talk about stigma. I'd love to talk about that later. But so postpartum depression, and then unfortunately, opioid use and opioid overdose, which is very, very common, and that happens quite frequently in women. So those are sort of the big issues. But if you can imagine, in some populations, mental health is the top reason for maternal death. And that's something that when I read those a couple of years ago, I was shocked.
Wow.
And it's gotten worse as well. So that's a big issue. And that, I think, ties into some of the social determinants of health.